welcome everyone. We're going to go ahead and get this convened at 12 o'clock on the dot. I've got a couple things I want to go over, and then there are a couple of individuals that I've asked to come and address the commission, so we're going to go a little bit out of order with respect to this. First off, there have been a slew of emails that were sent in from constituents across the county that were asked to be included or at least provided to the commissioners in relation to today's meeting. I spoke with Ms. Bentley, our county attorney, about that. They're going to be provided to the clerks to include in today's minutes so that they are part of the record, and they've also been provided to all of the commissioners. So if you sent an email, I appreciate that. Certainly please understand we are looking at them, we are reading them. So if you're more comfortable sending an email as opposed to coming for public comment in person, I certainly encourage you to make use of that if you'd prefer. Staff is also working, moving into the future here, to better enable us to have video appearance through the internet. So at some point in the near to intermediate future, I anticipate that you'll be able to sign up online, to be able to use a webcam and a microphone to appear for public comment that way. Also, I want to congratulate our emergency management staff and our public safety staff. I know that we have secured at least 100,000 N95 masks that have been on order here and should arrive shortly, in addition to tens of thousands of additional PPE, so personal protective equipment, things like gowns, face shields, things of that nature. And I'm also working with one of our staff members here as well to seek donations from some of the large corporations that may have stockpiles beyond what they need for PPE. So basically to bridge the gap until we get that 100,000 plus shipment of personal protective equipment. So we're certainly doing okay with respect to that. I know that there have been some times where we've run a little bit lower than I think folks have been comfortable with, but we've not at any point in time been at risk of running out at any point in the near future. So the couple folks that I invited to come out, first off, Maria Stahl, the administrator for the Florida Department of Health here in Brevard. If you want to come on up, I'm happy to give you as long as you need.
Good afternoon, Commissioners. I thought I would just go through and give an update as to the current state of affairs here in Brevard County. Right now, we truly do have community spread with our cases. And these numbers are from the 6 o'clock release last night, right before I came over here. The release was not there. The state does their releases between 6 and 7 p.m. and 11 to 12 a.m. And the 11 to 12 a.m. was not released right before I came, so it might be a few cases higher. We have had 32 cases. Out of those 32 cases, 28 of them were residents. So that means 4 cases are here in our county that are not residents of our county. We have 5 that are currently in the hospital. Out of the 5 that are in the hospital, 3 are on ventilators. So, and that is spread out amongst our hospitals. We've had 9 cases out of the 32 that are not related to travel or a case. So that's why we are now classifying the community spread. To talk a little bit on testing, the numbers that are showing on the state dashboard is a little misleading. The numbers that are showing on the dashboard, which is 500 and some, 555, I think it was last night, are only showing the cases that are going up to the state lab. So the cases going up to the state lab could be from us and it could be from the hospitals, but those are the ones going to the state lab. They are not reporting out those going to the private lab, which is LabCorp request, just as a state as a whole. And the state as a whole, there's about 5 times the amount going to the private labs than the state labs. So based on that, I would estimate between 2,000 and 2,500 labs are going to LabCorp and Quest. We do not know the cases that are going to LabCorp and Quest, but as I say that, any positive case from LabCorp, Quest, or state lab do get reported back in our state system.
So Maria, with respect to that, I apologize for interjecting. So the number of positives that you show on your dashboard, just to make sure we're on the same page, that's correct across all of the labs that are testing, whether
Correct.
It's private or whether it's state-based? But
Correct.
The number of tests that are shown as having been run on your DOH or your FDOH dashboard, That's just the state lab, so
Correct.
predominantly DOH and then whatever hospitals may send up there as well?
Correct. Every
you.
positive lab gets reported back to us. So
So
the
it
positive
may-
cases are everything.
So it may make the numbers of positive, I should say the percentage of positive, look artificially high if they don't show a corresponding number of individuals that were tested then?
Correct.
Thank you.
What is being shown statewide is there is, on any given day, a 7 to 13% positivity rate amongst all the labs. The state lab for Brevard County specifically is showing a 5% positivity rate. So the other thing is the first case was identified on March 17th. The second case was March 22nd. And we are seeing a doubling of cases every 2 to 3 days since then. So just to kind of give a perspective there of what's going on. Specifically talking on the testing, we are following Department of Health. We are one of 67 counties, a part of Department of Health. We are following Department of Health guidelines, who is following CDC guidelines. However, there's sometimes a delay, 1 or 2 days, but we are following Department of Health guidelines. New guidelines were released from Department of Health this weekend, okay? And to spell them out, priority 1 testing. Priority 1 testing is for hospital patients or hospital workers with symptoms, okay? Primarily, that priority 1 testing is being done by the hospitals because they're there. Priority 2 testing is patients in long-term care facilities with symptoms, patients 65 years of age or older with symptoms, patients with underlying conditions with symptoms, and first responders with symptoms. That's primarily the ones that we are doing through our drive-through collection sites at our clinics. Priority 3 says as resources allow, and depending on what's going on in the community, priority 3 is critical infrastructure workers with symptoms, individuals who do not meet any of the above categories with symptoms, individuals with mild symptoms in communities experiencing high number of COVID-19 hospitalizations, which we are not at that point. However, anyone that is now calling us starting yesterday that meets the priority 3, if they need to call their doctor first or try to get to an urgent care. If they cannot get tested from one of those places, but they do have a prescription from a doctor, we will test them. Okay? As I say that is beginning of this week, end of last week, one day meshes into the other, I'm sorry. But we did start our testing at our clinics. It is not busy. We have capacity for testing. So just as I say that. The counties that are doing the mass collection sites, they are either FEMA, hospital, or privately run. The health departments may be helping a little bit, but it's one of those 3. Okay. Over this weekend, they did, FDA did get approval for a rapid test kit, which is the first, which is actually very promising. The state is receiving some, and they're allocating them as they feel they should be allocated. I don't know where, we haven't heard specifically where, but probably more towards South Florida where they really do have a lot of cases. So as we move forward, I think the important thing is to continue our messaging, which is social distancing, 6 feet, no crowds more than 10, wash your hands all the time, cover your mouth when you cough or sneeze, stay home if you're sick, go home if you're sick. So that's the big messaging. The other thing I did want to mention is the state is mobilizing EMS teams to go into all of our long-term care facilities and just do frontline inspections and make sure they are adhering to no visitors, wearing masks, no congregate dining, just to make sure that is happening. And then if they find violations, it'll come to us, to go from there. So the other thing, we are working with emergency management, with Kim and Matt, on hospital surge plans. So where they need to go. So that really is what is going on right now, which some of the same of what you heard. But if you have any questions, please feel free to ask.
Commissioner Pritchett?
I got one for you. I was intrigued last night with the presidential address, and they were talking about hopefully soon having the test to run antibodies to see who's already got the antibodies for this.
Yeah.
Do you know do you have any anticipation of when it might hit the community that we can start doing that?
I do not, but I can keep you, we do have daily
Okay.
DOH calls, so if that comes about, I will
Okay, I'm
let you
very
know.
interested in that if you
And
get information.
To jump in, and I would ask if you don't mind helping me out with this one as well, Maria. My understanding, and Maria sent me some more info because we spoke about that some days ago, over cross-reactivity on the antibody kits. So the issue is with them testing IgE and IgM antibodies, there is a degree of cross-reactivity between other coronavirus strains and this. So even if you do show an antibody response to this coronavirus, this particular one, it doesn't necessarily mean that you've been exposed or infected by that. You could have been infected by a similar virus that's been out and about for long enough that you picked it up some other way.
Right, but
So
I'm guessing as you keep working, they're going to be able to define that a little stronger.
Right.
So
And
that-
even this rapid test, I was reading a little more in depth on it this morning. This rapid test, a positive is a positive. A negative isn't necessarily a negative.
Right.
So, that's, yeah.
Yeah, my understanding with it, and again, this is someone that had dengue years ago and had the phlebotomist basically pull a Dracula on me, testing me for everything under the sun. But they will, once they get that, if they do have an ability to genetically test through PCR, as is the case with this, it's there if you have the genetic material showing that it's that particular virus. So there is no false negative or false positive. Well, I should say there's no false positive with respect to that. But the antibody tests, they're certainly much better than nothing. And I think, maybe the way that FDOH will be going, depending on numbers and availability, would be to do initial screening with that if we still have an issue with respect to running enough PCR kits to determine who really ought to get the PCR testing. Because if they come back positive IgG or IgM, then maybe it's worth going ahead and testing them for PCR,
Right.
which would be more in-depth and more expensive and apparently less available. So I don't know if that's the way that the thought process is going. Or
Yeah, I can tell you that everything is changing on a daily basis. Just as Commissioner Pritchett said, the president said last night, but everything is coming down very rapidly and changing very rapidly. So I'll keep you informed.
I appreciate you
Mr.
coming
Chair,
out as
can
well.
I know
Please.
Commissioner Dr. Isnardi's on the line. I would just like to throw out to her that as she gets information on this, because she's probably on top of it, that she would throw it in our direction too. Ma'am, is that good?
Commissioner Snarty?
Good.
Okay.
Yeah, and if anyone has someone either in epidemiology or infectious diseases that they want to come in, and it's not to conflict with Maria, but to supplement anything or to add a different take on things, let me know, and I'm happy to invite them on behalf of the
Yeah.
commission to come out. I don't have any issue with that.
Yeah, the other thing I'll mention is in Brevard County here, we've been very fortunate to have a very good response from our private partners, our urgent cares. We have hospitals that are hooking up specifically with testing sites of their own. So when they do go to those urgent cares or they do go to, their private facilities, they are going to LabCorp and Quest. So, that's why everybody is saying our numbers aren't there. I think our numbers are. They're just not showing through the state lab.
I appreciate that. And one of the things that we addressed yesterday at the Sheriff's Facebook Live broadcast, I guess you'd term it, was the fact that we have at least one or two hospitals locally that are setting up tents outside. I think some folks maybe heard an urban legend that that's because we're running out of beds. But as I've understood, the reason for that, at least locally here in the center part of the county, is because they want to triage folks outside so they can determine where to send them and keep people separate. I've not heard that at this juncture we're at any risk of running out of beds themselves. Does that match your understanding, Maria?
That is matching my understanding, absolutely. And you're absolutely correct with the tents. We even have it outside of our clinics where we're screening people before they come into our clinics.
Perfect.
So,
I appreciate it. Thanks so much again. You've been great to work with.
okay. Thank you. You
Thank you.
too.
All right,
Okay.
Mr. Raines. So I don't know what your official title is at this point.
Hi, I'm Rob Raines. I'm president of United Way.
All right,
Commissioners, thank you for inviting me to share a little bit about the not-for-profit response to COVID-19. There are so many wonderful not-for-profits that are doing a fantastic job in this difficult time. I want to share that United Way, the Space Coast Health Foundation, and the Community Foundation for Brevard, and we're all funders. Space Coast Health Foundation and United Way do direct services too, but we were coordinating our efforts to see how we can manage this as best we can. One of the first things we did is we surveyed agencies that United Way funds, agencies that the Space Coast Health Foundation funds, and Community Foundation for Brevard funds, focusing on health and human service first. And so we're continuing to collate those responses. Many not-for-profits, just like businesses, are very worried about revenue. A lot of events that are the lifeblood or a big part of the revenue stream of not-for-profits are not happening now. Just like businesses, they're worried about their employees, and many have had to lay folks off. And they're very concerned about continuing to serve their clients, the needy clients, as best they can. When we looked at the needs in that survey response, a lot of things you would anticipate, looking for PPE gear or equipment, concerned about funding, childcare, mental health, food, those are the kinds of things. And we're responding to that. Some of them are responded for, they needed more volunteers. Meals on Wheels, a lot of seniors deliver those meals, and they are at risk, and we've sent over 200 people to help Meals on Wheels with delivery, so much so that they said, please don't send any more. And so those are the main things on that. Our United Way is focused on putting together a comprehensive resource guide for, it's really not, the chambers and the EDC are doing a great job in getting the word out to businesses on how they can respond in the different avenues. We're trying to do that for individuals that are in need, especially people that have been laid off. So we have a resource guide targeted to them. It lists all the meal sites that the schools and others are putting as we're getting that information, how to access unemployment and things like that. So that's at the United Way website, and we're updating that as we get new information. As we get more information about the CARES Act, we'll add that to that resource guide. We have created a COVID-19 response fund. I know there's others out there. There's really so many wonderful initiatives. I've seen some restaurateurs that are looking to help folks in the service industry for a tip jar. We would support all those different kinds of efforts where people's heart lead them. But at United Way, we've committed $50,000 from our reserve. We've raised from different groups and individuals another about $60,000. And our other partners will be kicking in some money as well. And we just got started on raising this for a COVID-19 response fund. And that fund is targeted to individuals that have been laid off. So to qualify, you've had to have been laid off or significantly reduced hours due to COVID-19, really, again, targeting service sector and those other areas that have been hit hard by this. To qualify, you have to have been laid off. A family income of less than $75,000 are some of the main qualifiers, and we'll help with rent and utilities and some food supports is what we're doing. And so the screening, people call 211 first, and they'll screen them for the qualifications, and then they'll be case managed by a team from United Way and Space Coast Health Foundation, and talk to them about other resources that are available, even if we can't help them. Obviously, the need will far outstrip the funding that we have, so we'll continue to try and generate more income. Our concern right now is this next month or so. We know help is on the way. Congress acted, the president signed in the CARES Act on Friday, but it's going to take several weeks for those new benefits to come down. It's going to take a little bit of time for the expanded unemployment and then that one-time gift. So our concern is people that have not gotten a paycheck in the last week, 2 weeks, 3 weeks, how they're going to feed their family. I think there's a little bit of comfort that utilities aren't going to get cut off right away, but they're still going to have to pay those utilities. There's a little bit of comfort that they're not going to get evicted right away, but they're still going to have to pay that rent. But putting food on the table is a big concern. So that's been our focus this week. We are, United Way's working a project to identify all the food banks, working with 2-on-1 and other partners, and to get where their locations are at, what their qualifications are, what their hours are, and we'll get that in that resource guide so people can go get groceries. Maybe people that have never accessed a food bank before may need to do that. And we're also trying to catalog all the different feeding sites. There have been so many great, what the school board is doing, what Community Kitchen, so many other partners are doing, but it's not, to my knowledge, it's not centralized in one place. And if somebody knows that, please get in touch with us, because we're trying to do that and get that out to where people know where those materials are at. Did you have a question, sir?
Yeah, I've got a question for you on the income limit. So let's say you had someone that had a very cushy job that now is making nothing.
Right.
Is it based on their current income or what they were making over the most recent year, or how do you all look at that?
I think the case managers are going to determine that. I mean, ideally, it was, we're looking at the thought process, and not everybody's different, but the thought process is that folks that had a little bit more income maybe had a little bit more resources and a little bit more depth, and we're looking. The target really are those people at the bottom end, the service sector, laid off from the hotel, laid off from the restaurant. That's who we're looking to serve first. But
appreciate it.
Yeah, but if somebody, like they might say, well, now our family income is less than $75,000 because we're both laid off, then we'll process that case.
I appreciate it, sir.
Okay, thanks.
Any questions for Mr. Raines?
Well, I just want to wrap up on the food thing, so because I'm just about done on the food thing. We did talk. We have talked with Ian, and we really want to work with the county on this and to expand food here. And I guess the next two things. So we're working through these things. We're concerned about some mental health issues. We're concerned about child abuse. I chatted with Janet Gendling, who's the president of Space Coast Health Foundation, and the Children's Advocacy Center, which is a United Way agency, an agency that they fund and run. Their child abuse report usually is 3 pages long per week. And this last one, it was only 1 page. And so logic would suggest, wow, that child abuse is down. But really, it's an indicator that the mandatory reporters, the teachers in the classroom, the child care workers, the people that have eyes on the children are not there watching that. And you can imagine the additional stressors that are in the home of homeschooling and such. So these are concerns that we're looking at moving towards the future and seeing what we can do to alleviate that. But we would look forward to partnering with the county. We have a great community, a caring community, and we're going to need everybody's support that can to help us get through this.
I appreciate it, sir.
Thank
Any
you.
questions for Mr. Raines?
All right, thanks.
Thanks for coming out. All right, so I have a few things I want to go over, and I'm going to do this before public comment, just so that folks have an idea in terms of what's going on and how they may want to focus their comments. So, Logan, could you pull up that website, or at least put that on the graphic? All right, so what you're looking at here, the Director of Emergency Medicine for a hospital that's in my district right here in the middle of Brevard sent me this site. It is from the University of Washington, from their Institute for Health Metrics and Evaluation. And when you look at this, even if the numbers aren't perfect, they give you an idea in terms of what the best estimates are. Let me see here if I can move the mouse. All right, so this portion right here, I know it's awfully small. That's April 1st, where the cursor is. This portion here is May 1st. And then over here, we're looking at June 1st. So where we are in terms of the resource count, and when I say resource, we're talking about beds needed, all beds needed, ICU beds needed, and ventilators needed. We're not at half of what they estimate this is going to be at before it reaches its peak. So to say the worst is yet to come, and I'm not trying to stir up fear, but the fact is we're not at the peak of this by any means yet. So the concern is what we do over this peak period of time, I think, is the absolute most important of anything that we do throughout addressing this particular issue. The fact is when we're on the tail end of the bell, or if you don't want to call it a bell, whatever shape you choose to categorize that as, there will be more resources available because we have less strain on the existing resources, even if there aren't more resources put into use. So whether it's beds, whether it's ventilators, forgetting what they produce now, which would make it even easier down the road, we really don't want to have our peak coincide with the national peak. So the idea of trying to smooth things out and delay people from getting infected here, it's not necessarily to prevent them from getting infected altogether. It's to delay it so that the hospital system and the healthcare system isn't overloaded. We're not at that point now. I don't think we'll be at that point in the next couple of weeks. But when you're looking at the peak of this thing, which appears to be April 15th, so 2 weeks from now, that's where it looks like it's estimated at peaking. So in terms of the peak, again, these are just estimates. They're talking about needing over 26,000 ventilators at the peak of this. And I don't know that we have that number in this country. So whatever we can do now, even if it's unpleasant or inconvenient, this is the time to do it. And we can look at relaxing things once we're past that peak. We can take that off if you'd like, Logan. So there have been some ideas that have been discussed, some ideas that I've had in consultation with others, both on and off the policy group. I've had conversations even with State Rep Randy Fine, who's brought up some interesting ideas. One of the ideas, and I would have to have Eden look into the legality and staff look at the logistics of implementing some of these things, but restricting boat ramps to county residents, I think that would be an interesting idea. I don't want to punish our residents for wanting to do one of the few things they have left to relax and avoid some anxiety, but I don't think we need to be inviting folks over here to use our boat ramps that don't live here. So whether that means we have someone in advance receive requests and take the whole number off of it, whatever they term that, the equivalent of their VIN. I can't think of what the terminology is for a boat. I've never owned a boat, but get the identification number off that and a description of it, and if something doesn't match, then we need to look at it. Another one is we need to potentially revisit the hour restrictions on the beach from 11 to 4 on the weekends. Again, the motion that was passed by the policy group was to restrict the beach access for 5 hours a day over 3 days, so a grand total of 15 hours. But that would cut off some of this tourism that we're seeing with folks coming over here. I know there was an article in the local paper, or one of the local papers, regarding hotel closures. What I will tell you is it was never contemplated as just shutting them down outright. We have folks that work for the DOD. We have folks that are staying in hotels because they have family members that are isolating in their house. Those aren't the people that are causing us problems. The people that are causing us problems are the folks coming from out of town, in particular the tri-state area, that are trying to escape either isolation or stay-at-home orders to come here where we enjoy almost total freedom at this point. So in asking Eden to look at putting in place, or what we could do to put in place restrictions on the hotels, one of the things that was requested along with that was to look at what exceptions would be appropriate. And at this point, the real goal wouldn't be to close them outright. It would just be to close them for leisure travelers. So if someone's employer sends them a note saying they're traveling for work, I would take the hotel's word that they've seen that and verified it. The same thing with a doctor's note saying that someone's there because they have a family member isolating at their house and they're trying to avoid that. I think that's fine. I don't think we need to police that. I think we can trust the hoteliers and the hotel industry not to want to infect their own employees if we do that. So with respect to that, I would ask Eden to continue to look into that. If someone wants to discuss it more today, I'm happy to. A couple of other items. I would like that, and I don't know if we need a motion or not. I think that staff can just kind of push this through without that. I would really like to discourage our county employees from using pool vehicles for anything but what's absolutely necessary. If you need a certain truck to do your job function, then that's fine, take the truck. But if you guys are heading out to lunch, or if you're doing something else that, quite frankly, you could just submit the mileage in your own cars, I would ask department directors to look at please allowing folks to use their own cars where they've already handled them. They don't have to worry about putting Purell and Clorox on them, rather than doing that and using our pool vehicles that other employees may need to use for something. So again, I would just ask each of the department directors to look into that. We've had a lot of good folks reach out to me with some interesting ideas, some great ideas, some interesting ideas, including one about having process servers supplement the sheriff's office in helping the Department of Health and other agencies check on folks who've been ordered to self-isolate. The good news is I've spoken with the sheriff. He said that at the present time and looking forward into the intermediate future, he doesn't anticipate we're going to have a need for that. I was considering making a motion to authorize that here. proactively so we could put that in place. I think it would be interesting not to have process servers perform any sort of enforcement role, but simply to check from a distance and call a person and say, hey, if you're in there, open up your front door and give me a wave. And if they're not, then report back either to FDOH or to BCSO and say, hey, we understand the person resides at this address and they work at this address. They were at neither. So it doesn't appear that they're self-isolating. There's something more that perhaps needs to be looked into. The last thing before I turn it over either for comment from my fellow commissioners or public comment, if that's the will of the board, we need to look at potentially doing notices for daily meetings of the county commission. And I know that sounds inconvenient, but let me just tell you, I have never been late to a county commission meeting. I've never left early from a county commission meeting. I've never appeared telephonically. If I can be here as an attorney, I think everyone can be here with the exception of those folks that either are in a high-risk group or those folks that are working in a field like Commissioner Isnardi that deals with this particular issue out and about. I would never ask anyone in a high-risk group or someone that's actually out there on, boots on the ground helping us with the situation to put that to the side to come in. The issue, and I think that the need for it, is based largely upon the fact that we need 24 hours notice to convene Board of County Commissioner meetings. And the fact of the matter is, if we have some emergency situation come up, we won't have 24 hours notice. So I would much rather notice them literally every day of the week, with the possible exception of Saturday and Sunday, and then have to cancel them last minute so that at least we have the opportunity of meeting, at least we've met the notice requirements. And if we cancel half of them, we cancel half of them. But, we're all earning a full-time salary. I don't think anyone here is earning under the median individual or household income based on this position alone. So, given that the board has suggested, or at least the message I've received is that the board wants to take over the bulk of the policy group's function, we need to meet as often as the policy group, or at least be able to do so. So, with that said, I see there's a light. I don't know if it's an old one, Commissioner Pritchett, or it's a new one, but I'm happy to hear from you.
Okay, sir. As far as calling the daily meetings, I'm okay if you want to put them out there. And then if we don't have anything that's imperative that has to be solved with a period of time, you can call those.
Perfect.
But whatever the other commissioners want to do, that's fine. I am also very sensitive to Commissioner Isnardi because she is really out there doing a service that I would not want to pull her off of. So her time means a lot to me as far as setting up meetings, but I know this board's very committed, and I do trust the direction from the board. As far as you were talking about the boat ramps, if we could do that with the citizens and the residents, if we could also do that at the beaches, we have just bingo solved the whole problem. So if that could work for boat ramps as far as that also, then we've kind of probably have brought in a solution for all of that. If it's legal for one, it must be legal for the other.
Can I jump in for a sec, Commissioner?
Yeah.
With respect to that, the issue that I think we may have is with the beach accesses, some of the areas where folks can come in, where we've received state of Florida grants. Our grants, at least some of them, require that we not distinguish or differentiate between out-of-county residents and in-county residents. So
Okay.
I think that may be more problematic than either of us would hope for. But if that's
Okay.
possible and if that's something that's enforceable, I would support it. I just don't know that
Okay.
it is.
The only other input on that is I really would love to hear from the sheriff and what he had going on over the weekend. I called him, and I called our local District 1. And District 1's really doing great. They're complying. The grocery stores are very reasonable. There's hardly anybody on the road. And I'm watching, I don't get to y'all's, but I know Brevard County is amazing. But I am really watching District 1 take this serious and do what they need to do. So I just wanted to state that, although we haven't done anything to mandate it. And I love that the president did the same thing. We're not going to mandate it, but you need to do this. And people really are buckling in and doing it. So I'm really appreciative for this county taking it serious and doing all the things that they need to do. I would want to really throw out, sir, I know we're going to have some other discussions, but if you are in a high-risk category and over that age, please just stay home. If you're home and you're not getting out, you're not going to get infected. So I just really want to reiterate that again to help bring some comfort out there. And, sir, that's all I wanted to comment on the things that you had just said.
I appreciate it. Commissioner Smith or Isnardi, do you all have anything at this point, or do you want me to go into public comment, item 3 on the agenda?
Yes, Mr. Chair, I just questioned your request earlier for staff to look into all these proposals. And I just wonder what my fellow commissioners think about those proposals.
Do you want to be a little more specific, Commissioner Smith, in terms of the particular proposal?
Well, all of them actually, because I'm just listening to this, and it's your idea, but I don't know if the other commissioners agree, because if some of us don't agree and don't have discussion about it, then we're unnecessarily asking staff to go about creating work for themselves that otherwise isn't necessary. Because if they report back to you and say this or that or the other thing, and then we vote it down because we weren't interested in the first place, we've just wasted a lot of time and effort. That's my point.
Commissioner Pritchett?
Yeah, Commissioner Smith, if you're okay with it and you guys are okay with it, I don't mind Ms. Bentley coming back to see what the legality is as far as Brevard County residents and what we're able to help them with to isolate them from other parts of the country. But that's just my thought on that. I don't mind Ms. Bentley coming back with some data.
Any other commissioners?
Well, I don't have any problem with that either, because I think one of the things that has been reported to my office is that because we haven't asked for a stay home, I think that's what it's called, from the governor, and he has himself said that his office would help us prepare a stay-at-home order. We are way down on the list of test kits, and if we were under a stay order, more test kits would be available to us, and I think more test kits would make our citizens feel better about what's going on, because, quite frankly, we have an awful lot of vacuum in what's going on, and people fill vacuum up with speculation and horror stories and rumors. And so I would like my fellow commissioners to weigh in on that also, if they think a stay would be helpful to us moving forward.
Commissioner, let me jump on that for a moment. I know that our representative, Randy Fine, is watching this. I talked to him right before the meeting. He said he'd be watching it on the web. I know that Randy as well, Representative Fine, I mean to say, speaks with the governor 3 to 5 plus times every day and has been over the duration that we've been dealing with this. I've never heard anything along those lines from him, and I've been speaking with him roughly daily, sometimes more often as well, just based upon his connections in Tallahassee and his involvement with this particular issue. If that is the case, that we're receiving fewer test kits than we otherwise would because we don't have a stay-at-home order, I can tell you that's news to me. I would just ask him to look into that over the next day. And we've got Maria Stahl. I don't know if you can come up for a sec and address that to whatever degree you're able to. She may have more knowledge than
I can also concur. I don't think the stay at home is going to be concurrent with test kits. I think the test kits availability is more being allocated based on the need of the counties, and a good portion are going to South Florida right now, and they have over 1,000 cases in Dade and over 1,000 cases in Brevard. That said, Representative Fine has been instrumental in getting us the kits that we have gotten. So right now, I can, as I said when I was up here, we have capacity. I watch the collection going on in the Vieira Clinic right outside of my window, and they have not, they have a capacity to see the clients. So they do need to call our number for screening, for eligibility, because we are not going to test asymptomatic. We will not do that. We need to preserve it for the symptomatic, people that meet primarily the priority 2. We will do, like I said, the priority 3 with a doctor's order, but the number is 321-454-7141.
And Maria, I apologize for asking this question. It's one of those things they tell attorneys not to ask a question if you don't already know the answer, but I'm genuinely curious on this one. Have you all, to your knowledge, turned away anyone that's in any of those priority groups, including the third priority? So let's say Commissioner Pritchett or I, we went to a gastroenterologist or a dermatologist or an oncologist or some other specialist, not even necessarily infectious disease or someone in that line of work, and they said, wow, you really ought to get tested for this. We'll give you a note, and it's signed by an MD or a DO. and they send me your way, has there ever been a case that you're aware of?
I would say early on, yes, because the criteria were different early on. You know, early on,
Okay.
they were focusing more on the travelers, the cases, the contacts to cases. That has switched dramatically now to really looking at the elderly and those that have medical conditions. And just this week, you know, we started with, you know, if you meet that priority. And the reason that we did expand it to priority 3 is because we're saying we're doing priority 2 and we're not filling up. We're not using all our slots. So let's open it up to priority 3 with a doctor's note. But everyone should call their doctor first. Their doctors know their medical history. So the doctors will determine, yes, I think you should have a test, and then write the script.
Out of curiosity, again, I don't know the answer to this. I truly don't. Today and yesterday, did you have any unfilled appointments where someone could have gotten tested had they set it up for one of those
Yes.
3 priority groups?
Yes.
Today and yesterday, or just?
Yes.
Okay, well,
Absolutely.
I think that speaks as to
Absolutely.
the concern that we don't have enough. I'm not saying that we have as many as we would want. I think, you know, maybe you would be testing, I don't want to say prophylactically,
Yes.
but I think you'd probably be expanding it if we had an exponentially higher number.
And I
but-
have 2 state representatives both that have told me, if you need more kits, you let me know, and we will request them for you. So, but we do have a request in also for some kits. Just moving forward, we're probably going to need some more, but we do have enough right now.
Perfect. I
Okay.
appreciate it. Commissioner Smith, do you have any other questions?
No, I just have a comment. I want to thank Maria for her info. It's good information. And like I said before, we need to get as much information out as we can, all the different news sources, because people are freaking out. They don't know. And this particular, my office has fielded a lot of those calls about we're not testing enough people. And we, in fact, got one email from a couple. They're both nurses, and they say, and they're on the front lines also, that there aren't enough test kits coming out. We're not testing enough people, so we really don't have a handle on where we stand here in the county. So all of what she said is good information for us. But again, I can't stress enough that we need to get the information out to the people because, again, they're hysterical. People without cause are worrying about they're all going to die, and information is key.
I don't disagree with you, Commissioner Smith. And again, with respect to the item that you brought up with the stay-at-home order, obviously, if that's appropriate, I think we'll do what we need to do. But, you know, my goal, one of my goals with respect to the whole issue has been to put in place other measures that hopefully enable us to avoid having to do that. If we've got to do it, we've got to do it. But I think there are other things that we can do that are a little bit more innocuous, that are a little bit, well, I should say a lot less intrusive in terms of individuals' liberties than a stay-at-home order. So, you know, maybe, again, if folks are willing to reconsider the beach issue and closing the beaches or at least restricting the hours of the beaches on the busiest times, on the busiest days, I think that may put us in a position where we can avoid having to take a, I don't want to say almost an authoritarian step of having people told they can't leave their homes. But I would really, if we can do other things that would allow us to achieve the goal, I would rather do it that way and see if it's necessary to go that extra step. But again, everything that we do over the next 4 to 6 weeks, I think, is going to be really determinative of how this county fares. So if we do things now, I think we can avoid a lot of pain later. The fact is, you know, you've heard that folks who are potentially exposed may have to self-isolate for 2 weeks. The reason being, obviously, you have a period of time between someone getting exposed to this than someone becoming symptomatic and down for the count, so to speak, or potentially down for the count. So that time frame and that bell curve that I had online or on the video earlier, you know, that shows where we're expecting the peak, but that's going to be as a result of things that happen a few days to a couple weeks prior to the peak. So everything we do between now and then really matters all the more. So, you know, again, I don't want to make a motion that I'm going to get shot down on, but I really do think at some point in the very near future, whether it's today or whether it's later on this week when we have our next Board of County Commissioners meeting, we really need to look at that beach issue again. Commissioner Pritchett?
Yeah, just a request, if we could request Sheriff Wayne Ivy to come in and we have a good overview. John Tobias shook his head. That was kind of cute at the moment. And have like a little quick overview of what his recommendation is. I'd really love to hear from him.
Did he
'cause
shake
it's
that he
just-
didn't want to hear from the sheriff, or
No,
did he shake in
just-
agreement?
He made a face that just tickled me. It wasn't a bad face, but
All right, Commissioner Smith, what else did you have, sir?
Yeah, along with the stay order, we've been fielding a lot of calls from businesses that say without the stay order, they can't receive certain funds that would allow them to get low-cost loans, and it would allow them to pay, or maybe not pay their employees, but for their employees to receive certain benefits that are available if the business is made to close as opposed to voluntarily close. Because if a business doesn't have people coming in, they only have two options: stay open and lose money, or close the doors and stop the bleeding. Well, if they have to close the doors without the stay, their people aren't eligible for the additional funds that I understand are available. And I don't really know, but I'm just passing that information along so that maybe somebody that knows more than me can address that.
Yeah, Eden, I don't know if you'd mind taking a look or having someone on your staff take a look at that, because my thought is I think that in and of itself, I don't know if that rises in my mind to the level necessary to justify a stay-at-home order. If it's otherwise justified, that certainly adds to how compelling it is. But I wouldn't order people to stay in their homes solely so that a subsection of our society or population gets an economic benefit, even if it would be a nice benefit that they otherwise might be able to make use of. But if that is a concern, obviously we need to look in the future if there is a stay-at-home order. And again, I truly don't want to have a stay-at-home order. I don't know that anyone wants a stay-at-home order that's on the commission. But we would need to look at what exceptions apply to that, because I don't think that the idea of telling people we're going to arrest them if they leave their houses, if they've got legitimate business to attend to, whether it's going to a grocery store or otherwise, I just don't feel warm and fuzzy about that. And I think there's so many steps that we can take between now and getting to that point, which hopefully we never have to get to, that would discourage folks from being on top of one another and enable them to social distance. I don't know that I can make that jump without doing some things in the interim, again, with respect to the beaches, with respect to the boat ramps, with respect to hotels. And frankly, I've got to tell you, for folks that are here for leisure purposes, with respect to those that are here during the local state of emergency, I gotta say, at a minimum, I would say we should not extend their reservations if they're here for leisure. And I don't necessarily have a problem saying, look, we're booting you. You've got 48 hours and we're going to boot you if you're here for leisure, unless you have a note from your employer saying you're here for work purposes, or alternatively from a physician saying you're here for the purpose of avoiding staying at home with someone who is isolating. I don't have empathy for the folks that are exposing our residents to a potential issue, that are fleeing these high infection rate areas. I really don't, because their selfishness in coming down here and exposing us is putting us at risk. Commissioner Pritchett?
just real quick, Representative Fine just sent us a text, and I just wanted to state that he said
Please.
that anybody who has trouble with being out of work, he said that you could call his office and he will help set you up with the program or some unemployment. So
Excellent. Do we have, I don't know if anyone on staff has a number for his office? My computer's doing a restart right now.
Give us a minute, we'll get you the number.
Thanks. Okay, just when you're ready for it, just let me know and we'll put it into the audio here. So Commissioner Isnardi, did you have anything, ma'am?
I can speak now.
Please.
Whatever's easier. I'm not sure your order of things, but
It's fluid.
I would just encourage people to continue to be smart. I would ask you just indulge me for a minute talking about changing the way we do things. And I think that we've all sort of are learning how to do things differently. I think going after the low-hanging fruit may not be the wise way to go. I think, and there's no way to monitor or regulate movement, but I think the bulk of our issues are places where large people gather, like grocery stores and that sort of thing, because there's no social distancing going on at Walmart. And I hate to use them as a name and put it out there, but I walked in there the other day and walked straight back out. So I don't know. We've been walking our beaches in our district, and I understand why places like Cocoa Beach and other areas that are spring break destinations had concerns. But we walked those beaches for the last 5 days, and not only were there very few people there, they were well practicing social distancing. We have pictures, we have videos. We walked miles of beaches over the last 5 days, and I can say that our residents are doing the right thing. And that probably has a lot to do with the fact that we closed off the public parking. You know, I don't know that that's the same case in some other areas, some other municipalities, but I know at least in District 5, our beach people are abiding by those rules. So to create more rules for them based on the fact that they're behaving by those same rules, probably, at least in my district, would not be wise. Ballard Park, however, which, you know, is municipal park, was crowded. Picnics, kayaking, families gathered, large groups of people gathered, and that sort of thing. So I would be probably more hyper-focused on that than on areas that are actually doing the right thing. And completely unrelated, I would encourage people, I mean, we've had a lot of people contact my office as far as my doctor's office, working and seeing patients. A lot of places are switching to virtual visits because we see a lot of senior population, and we definitely don't want to put those patients at risk. So we've been seeing a lot of our patients through Health First Medical Group where I work. We've been seeing a lot of patients virtually, not just for their follow-ups, but for minor acute issues. We've screened people. You know, we've saved them the trouble and risk of them coming in. So we've screened people to see if they've needed testing, COVID testing. So virtual visits are, you know, the wave of the future, and they've been very beneficial, not just to keep people safe, but to keep our staff safe as well. Now, we've not been able to convert everyone that way, but at least we're making big strides, and we're still able to serve those that don't need to unnecessarily expose themselves to potential, you know, infected individuals. So I would encourage people, look into virtual visits. A lot of insurance companies are waiving their copays. I know Health First, I believe, even has a $50, if you don't have insurance, flat fee to try to accommodate people. And if it gives you peace of mind, it's well worth the 10 to 15 minutes it takes to do it. And it's very, very easy to use. We have a lot of senior citizens that are using the platform just fine. So I just want to encourage people to think a little bit outside the box, because there's people that have chronic health conditions that need to follow up. That isn't just about the virus that's currently going on. So my shameless plug for Health First. I didn't mean to do that. I just was talking about some of the things that we were doing in the healthcare community to help our residents.
I appreciate it, Commissioner. I do have the contact info for Randy Fine's office, the representative. Email is randy, R-A-N-D-Y, .fine at myfloridahouse.gov. So randy.fine at myfloridahouse.gov. And his phone number is 321-409-2017. 321-409-2017. So with that, staff, I don't know if we have folks queued up for public comment. Jim?
Last I checked, we have 3 for public comment.
Would now be a good time?
Yes. Mm-hmm.
All right, let's go for that. Logan?
Chairman?
Please.
Chairman Lober, I would just encourage you to direct people not to touch the podium, because everybody's leaning and touching the podium. So just as we're talking about social distancing, we might want to remind folks that.
Logan, I don't know if you have any Lysol up there too.
The
May want to just leave out some Lysol wipes as well, so folks are more comfortable and they're germaphobes like I am. Oh, okay. Yeah, Commissioner Nardi, we don't have a podium, so they're just standing at this point for the area where they're doing the public comment. Okay, so let's...
Okay, I was probably more referencing the others that spoke before. Thanks.
Okay, yes, ma'am. All right, so we'll go to public comment then.
My name's Eva McDaniel. I'm from Melbourne, Florida. How is everyone today?
Doing well, thanks. Thank you for coming.
Very good. I have lived in Melbourne, Florida for 18 years, and I'm from Austin, Texas. I'm a landlord in Austin, Texas. I have a commercial building on Guadalupe in front of the University of Texas. I also have a house behind that. I went there on February 28th for 3 weeks to work on my property. I came back on March 17th, and I've been self-isolating since that day, which was 2 weeks ago today. When I left Austin, the city of Austin canceled South by Southwest, the largest music conference in the world, on March 10th. On March 19th, they placed shelter in place for over 1 million people in the city. Shelter in place means that you're required to stay in your house unless you need to go out for necessities, such as groceries. They have a list. And when you do go to the grocery store, only 10 people are allowed inside the store at any one time. You're stating that you don't think that we're going to hit a peak in 2 weeks. We'll see what happens. I don't want to keep my citizens down, this, that, and the other, is a ridiculous statement. You have no idea how many people are already infected in our community. I had to go out for groceries. I'm very conscientious one time since I've been home. And when I drove down Wickham and saw that the parking lot at Home Depot was the most crowded parking lot I've seen since I've lived here. People are not taking precautions at all. It is ridiculous for you to think there are not infected people walking around our community infecting others. And I don't get it. There is nothing to say that our citizens don't want to stay safe. If you follow the Facebook feeds that are going on in our community, a lot of people are in favor of shelter in place. It saves lives. It gets our community back on their feet faster than if you sit on your hands and wait to see what happens. If you have this thing grow out of control, like it will, you're going to see a lot of bad things going on in our community. And you're going to see not only sick people, you're going to see an economy that will crash. You'll see an economy that will take that much longer to get back on. When you have a city like Austin, Texas, with over 1 million people abiding by the shelter in place, they went from 0 cases on March 17th when I left that city. They have just over 300 cases today. That's not a lot for 1 million people. Mayor Steve Adler, follow his page. See what the other big cities are doing. New York City is completely out of control right now. Please place shelter in place now. We're begging you. We've emailed you.
Ma'am?
We've emailed all of you commissioners.
Ma'am, I apologize,
Thank you.
but you've run out of time. I appreciate you coming out. Welcome, sir.
Good afternoon, Commissioners. My name is Michael Fitzgerald. I'm from Melbourne Beach. I'm here to talk about a couple of things. First of all, I'd like to thank Commissioner Lober because over the weekend I worked with him throughout the weekend, from the early mornings till late at night, both Saturday and Sunday. And when we came in here on Monday, all the county offices have now put together any spare PPE they have, and they're giving it to public safety. They are soon to run out of PPE. And as you all know, PPE is backlogged for 3 to 4 months. Not only the country is looking for PPE, but the entire world. So now that PPE is going to be used by the people who are going to be in the front line. What I'm really here for is because I've been talking with Commissioner Lober about this. We have to draw upon our own resources now to get PPE. Now, the mother lode for PPE in this county lies in our Space Center. The Space Center has labs. They deal with the most dangerous materials in the world, and I know that they've ordered ahead. We have to ask them to see what they have. I mean, don't leave their employees unsafe. But if they have 3 to 4 months PPE on hand and they have more that they could share, you as a commission, you have a fleet of trucks out there that can go get them and get them to our hospital. And there are other health facilities out there like MedFast who are fast running out of PPE. Now, over the weekend, working with Commissioner Lober, I have found out, because he's asked the hospitals, how are you on PPE? And they are telling him they are fine for now. Now is the operative word. If this thing ramps up, Our healthcare providers are going to need a lot of PPE. You turn on your television in New York, it is not a joke. They are running out of PPE. They need it. And we have to make sure that doesn't happen here. You know, we have in our nation, we have a military which gets $800 billion a year to protect itself. Our healthcare workers are going to be our frontline people. Now think about this. We're worried about touching a table. They have to go into an IC unit with people that have the worst form of COVID-19. There's several forms of this, because if they're in the ICU, they got the worst, and they will be spewing and coughing COVID-19 all over the place. They will be covered in. I don't know how much they have, they need, but whatever they need, we have to make sure they have it. They cannot go into this battle alone.
Sir, I apologize, but you're out of time at this point as well, but I'm happy to continue communicating with you offline about this. So, I think that there's a lot that we can do, but I've got to be fair to everyone and treat everyone equally. So I'll shoot you an email soon, but thank you again, sir.
Okay. Thank you and have a good day.
You too. Thanks.
Hi there.
Hello.
Hi, my name is Kathy Smith. I'm a hairdresser in Satellite Beach. I left the salon about 3 weeks ago. I was aware of what was going down. I was paying attention to the scientists. The shop, I was begging the shop to close. Well, now here we are a few weeks into it, and every day that you, or whoever the powers that be, I've called the city manager, I've written Randy Fine, I've called people, I've got zero response. So I love how you guys pass out email addresses as if someone cares when I didn't even get an auto response. But having said that, every day you do not close salons, hair salons, and the spas, nail salons, and all of that. What happens is you're hurting us further, because now we're responsible for paying over $5,000 in, like, even our rent bill. They won't forgive it. You know why? They say, you're open for business. The authorities closed you yet? And as soon as we say no, the authorities have not closed us, they expect us to pay full rent. Until you, not to mention, the really important part is we're endangering the community. Would it be okay with you right now if I came up there and ran my hands through your hair? Any of you? Would it be okay with no gloves, no mask on? Can I come touch your hair, run my hands through your hair? You wouldn't allow that. Why are we talking this way? To keep distance. Well, I can't do that in a hair salon. I'm going to be in your face, waxing your eyebrows. I'm going to be scrubbing your head. You're going to be right there. I live in Satellite Beach. All those condos with all those elderly people right now today are going into that hair salon. That's okay with you? On what planet is this okay? Close the hair salons, close the nail salons. You're not hurting us by closing us. You're hurting us by staying open. Your response? Can I come touch you? Can I come touch you? No, you don't want me to. This isn't fair. Close the salons. We're begging you. I'm done. Now go back to doing whatever the fuck you want.
Well, apart from the profanity, I think she does raise a really good point. If people are physically incapable of maintaining a degree of distance with hair and nail salons, it may be something that we look at. I've got to tell you, if someone were to make a motion right now to close hair and nail salons, I wouldn't have any problem seconding that and supporting it. Commissioner Pritchett?
Well, I think, sir, that if they feel that and they're not able to comply with the CDC regulations, they need to. But there is going to be, I gave you all some information, there is going to be some financial help coming for those businesses that are directly affected by this virus. It's going to be those ones that weren't able to sustain anymore because of this. It might not be right now, but there is some funding that's going to come. And when they show they had to close because of this, for those reasons, there's going to be extra funding coming to help them. I've got some data here. There's going to be more coming down the line. But I agree, if you work in a business where you're not able to comply with CDC regulation, you need to quit. You're just going to have to find a way to withdraw. I work at a church. trust me, we're finding a way where we've just quit doing it, and it's going to affect income. But you have to be responsible to the community, and you have to do those things that are right. And I'm just trusting that we have some stuff coming down the line to help with this. It is tremendously painful to a lot of people. We have a lot of people that have lost jobs that I'm directly in relation with, and they're having a hard time. And this is not easy, but I'm going to tell you right now, we did not cause this. But when we start shutting down businesses that are able to bring some income in now to feed their families, that's critical. So I think the path we're taking, if you are in a position where you need to quit doing the things you're doing because you can't comply with these suggested regulations, you need to quit doing them. And you need to do those things probably right away. And just know that there's probably help coming. Reach out to organizations for help with food and money. And I'm so thankful that Mr. Fine sent his number to get some help also. But it's tough all around. But I just want to state this, is, nobody caused this. It's something that happened, and it's horrible. But we've all got to work together and try to think of what we can do to help bring some kind of hope into the situation.
Do we have any further public comment? That's it? Okay, that's it. I'm being told by staff. So we have next up on the agenda board reports. I know we have Mr. Abate by phone. Frank, do you have anything, sir?
Yes, you do. Yeah, actually, we have two items. The first deals with the scheduling of meetings. If John Denninghoff is there, he can take the lead on that relative to some upcoming meetings that we have.
Sure. Mr. Denninghoff?
While John gets ready or he comes over, let's take the second item, which deals with procurement and the PPEs that you discussed earlier.
Please, sir.
We have Steve Darling and Jim Liesenfeld to speak to that issue because we need to get some board approval and board direction on that. So, Jim?
We've got John already at the podium, so if it's all right with you, Frank, we'll take John first, and then we'll go to Jim and Steve.
Sure. Thank you.
Yes, sir.
What Frank's referring to is specifically the land use meetings that we have, advisory board meetings that we have, and then, of course, the land use board meetings that are held associated with them. We have a couple that have been advertised with, at least in one case, we've got one or two contentious items or controversial items that are on there. One of the difficulties that we have with the advisory board meetings is that they are, in the case of the LPA and the P&Z, this dais is normally full with extra chairs jammed in here. Members of the board, advisory board, on both sides of the board meeting with sometimes as many as 16, 18 different members of the board and alternate members of the board. Very difficult for us currently to be able to deal with social distancing issues associated with those. We are looking into technological solutions to try to be able to deal with that appropriately and to allow the applicants and the public to be able to comment and provide their presentations, which they would normally try to have. We just aren't quite there yet. The meetings that we have for just the commission are difficult by themselves, but these advisory board meetings are a bit daunting. So
I apologize for interjecting. I think I can make your life a little easier here. I would ask someone to give me a motion that I can second to authorize staff to cancel any such meetings if they're not able to implement appropriate measures to allow for social distancing of at least 6 feet.
Make a motion to approve.
All right, I'll go ahead and second that. Any further discussion? And again, this is to allow staff to do it. If you're able to implement appropriate measures, I prefer that you not cancel. If you're not, then obviously this is just going to give you the ability to do that. Commissioner Tabaya?
Thank you, Mr. Chair. And I'll be supporting this. I think, however, we need to do, and Mr. Denninghoff and staff is certainly working extremely hard to make these people that have gone through the process get an answer one way or another, and I think it's incumbent upon all of us. There are two ways that we can expedite this. One of those ways, and I just talked to Mr. Denninghoff about this an hour ago, so he hasn't had the time probably to look into this. But number one is administratively, things that they can handle on the back end. The other is legislatively. There are things that we can do as a board that he can't do as administrator. One of those examples, and it comes with technology, may be NMI. So the NMI board group meets in a church somewhere that we don't have the ability to, or to set up the technology that would allow citizen input. So I would hope by our next meeting that Mr. Denninghoff could get us a list of decisions that he can't make administratively that we can make as a board, such as requiring these advisory boards to meet in a location that was conducive to getting these back in order in as short time as possible. So again, they're doing all they can, but there are certain things that we have to do through ordinance or through statute that he just doesn't have the ability. So I don't want us to be the roadblock on it, because I know how hard they're working on it. So again, you'll get my support, but I think there's things that decisions we need to make on this in short order. I unfortunately just don't have that list offhand.
Makes perfect sense. And just before I call on Commissioner Pritchett, one of the other things is we've had a lot of folks email my office specifically about NMI and their meetings. If folks want to send their comments by email, we can certainly ensure that they get distributed to the folks that are on the board before the decisions are made. They can be brought up at the meetings, and folks can be given hard copies if they prefer. So anyone that wants to take steps over and above what we put in place as a county or what's put in place by the state or the federal government, please email. It's not that those emails aren't going to be seen. If that makes you feel more comfortable, if that puts you in a position where you feel safer, certainly do that. Commissioner Pritchett?
Yeah, I don't mind even if we put everything on freeze till we're through this. The reason why is, even as a commission level, if we did anything, I'm not going to vote anything to change status quo at this moment. There's just too much going on, and I don't even want staff or anybody out there having to put that much thought into a lot of changes unless it's an emergency. So I wouldn't even mind suspending this for a while until you have a time period you think that we're on the other side before we start talking about even moving forward or even making some changes looking back. So I will support whatever you guys want to support, but I'm thinking heavily that might be a good idea.
Mr. Denninghoff, what are your thoughts, sir?
Well, there is one item that's on it's a regular commission meeting, and we can continue to do those just as we're doing them, but we are looking to try to make them better. Always looking to improve things, but we do have the biosolids item that's on the April 7th board meeting, and we have an expiration date issue that's going with that. So we definitely need to have there are items of business that really do need to move forward. So we don't want to cancel anything like that.
Perfect.
And as Commissioner Tobias was suggesting, we are working very hard to try to figure out a good way to do this so that we can control the meetings in the manner they should be controlled and allow the access to the public the way they should be, as well as the applicants and all the rest of it. But there are challenges there. There are communities that are doing some things, but they're also running into problems. So we're checking with them, see what they are doing, to see if we can learn from their experiences. And by the way, they're calling us, asking us how we're doing things. And so.
To that end, with what Commissioner Pritchett mentioned about leaving the status quo with the biosolids, I'll just tell you right now, I'm not going to make it any more or less restrictive until we have a better ability to get a grip on the thing. So when that comes up, if that comes up still, which I hope it will, my position is leave it as it is. Let's just extend it as is for the time being, and we can revisit it later when we have a chance with less pressing matters to attend to. So anything further, Mr. Denninghoff, or do I move on to Jim and Steve? Run while you can. All right, Jim, Steve?
Yeah, thank you, Mr. Chair. The Emergency Management Department and Purchasing Department has found an order of 100,000 K95 masks. The total cost is $375,000. We're asking for the board for a motion of, due to the high demand of PPEs and given the current state of emergencies, We're requesting that the board consider authorizing up to 60% of the total amount for each PPE to be paid to the vendors at the time of the order in advance of receiving the PPE order, with the balance due either upon receipt of the products or notification and confirmation of shipping of the products.
May I please have a motion, Commissioner
Make a
Pritchett?
motion to approve.
I'll second that motion. All in favor of the motion, say aye. Oh, hang on one sec. I apologize. Mr. Tobias? Mr. Tobias?
Thank you, Mr. Chair. I'm not very familiar with the procurement process. I hearing what our emergency management director, Jared Moskowitz, has said. There's a lot of, for lack of a better word, shysters out there. Can you help us before we make this, that this is from and I know you've probably done this, but for everyone's benefit, will you let us know, how you've gotten these, how we know that this is a legitimate vendor, all that good nonsense?
So we've done the due diligence, looking them up.
Hang on one sec, Commissioner. Steve?
We've done the due diligence, looking them up, researching the company online, confirming that they are, federal contractors. The company that we have found, we have confirmed they are a federal contractor, services-owned, veteran-owned, have federal contracts of the sort, and doing that due diligence, we're comfortable.
Yeah, and I'm very sure you have done that. I just wanted to hear all the steps that you had taken to make sure that we're not going to get the short end of the stick on this one.
And that same due diligence would be exercised for any PPE equipment that we procure, where they would require something down in advance of shipping it.
Thank you for all the work on this one.
All right, I'll go ahead and call the question at this point. So all in favor, say aye. Aye. Any opposed?
Aye.
All right, passes unanimously. Oh, on the social distancing?
That's it for me. Thank you, Commissioner.
Thank you, Frank. Bear with me again. If you could help me with the text of that motion? Thank you. Yeah, I apologize. We had the motion on the floor. I got a little bit disjointed here with that. Okay, so the motion that we're addressing at this point is to authorize staff to cancel any meetings, advisory board meetings, that they are not able to take or make adequate preparations for to enable social distancing. So with respect to that, any further discussion? I think we've had a second as well. All right, so we've got a second. All in favor? Aye. Any opposed?
Aye.
All right, passes unanimously as well. All right, so we'll move down the line. Ms. Bentley.
Regarding the public comment via email, today we provided you public comments via the electronic messaging method, and we printed out copies of those emails for you and the clerk. It was a little bit of a problem at the last minute. If you could encourage your citizens to send them in ahead of time, it would be very helpful to ensure that we have all of them for you and the clerk.
Okay, so folks, just to the degree that you're able to, and I understand things come up, if you can try to get them to us before close of business the day prior to the meeting, I think that would be a reasonable amount of time where you all have the ability to have the input that you'd like, but it also doesn't put our staff in a bad position. So whatever you can do to get us input by, if it's written input by 5 p.m. the day before, I think that would certainly help. Let's see, Commissioner Pritchett.
Yeah, just real quick. I know we have another meeting scheduled for Friday, sir, and
Yes,
you're going to
ma'am.
go ahead and get on the books every day, and then you're going to let us know when we need to come in. Would it be possible to move that to Thursday? Let me tell you the reason why is I know Commissioner Isnardi has heavy patient loads on the Monday and Wednesday. She stated that. So if we could do that, because you're going to go ahead and have all the meetings on the book, that we could do that, I think that would help best serve this commission.
Commissioner, I'm happy to entertain a motion on that, but before you do make the motion, my thought is, with respect to this week, since we've already noticed it to my understanding and it's gone out, I would hate to cancel it at this point.
We'll leave it open, but maybe make one for Thursday also, and then we can meet Thursday. If there's an emergency, you've got Friday ready, but then I think it would take the load off Commissioner Isnardi.
Sure, I'm happy to set one for Thursday as well. I don't need a motion for that, so I'll set it for Thursday. So just to give staff direction, at this point, if you all don't mind, let's notice another one for Thursday at noon.
Yeah.
I think that's easiest because if we all have different things going on every day, we can at least appear telephonically for those of us that can't be here in person. Let's go ahead. We'll do Thursday at noon. Friday we've already set for noon. And then starting next week, we'll just set every Monday through Friday, inclusive of Monday and Friday, for noon, and then if we need to cancel them, we'll make the decision on the spot.
Perfect.
All right, thank you. All right, so we've got that. Commissioner Tabaya.
No report, Mr. Chair.
Commissioner Smith on the phone.
Yes, I just wanted to clarify, if you're going to, and I understand the purpose, so that you have these meetings on the books because of the 24-hour rule.
Yes, sir.
When do you anticipate canceling them when we're not going to meet? I mean, is it going to be 1 minute to 12 on Tuesday that you're going to notify us that if there's no meeting?
I'm not going to do it to you guys a minute before. I would do it far enough in advance that someone wouldn't have to drive from any part of the county to be here. So I would say if they're all set for noon, probably 9:30, something like that. We'll make a decision at that point. That's late enough and early enough. Yeah, if I know the night before, I'll let you guys know. But let's say no later than 9:30. Will that work, Commissioner Smith?
Yes, that's fine.
Okay,
I
perfect.
just wanted to know when to expect it so that I can govern whether I need to be ready or if we're not going to be ready.
Perfect. No, I'll do what I can to give you as much notice as possible. I just don't want to do it 12 hours in advance, or I shouldn't say that, but I don't want to do it 24 hours in advance because we don't know what changes in a day. Hence the reason we're setting these every day. But yeah, if I can let you guys know by 9:30 at the latest every morning, I'll make every effort to do that. All right, Commissioner
I think that
Darty.
works, but I'm not the one that has to travel. The other guys do. All I have to do is open up my laptop and turn on my phone.
No, I promise you. I mean, if there's a meeting, I'll be here for sure. Anything further, Commissioner Smith?
Oh, you did.
Thank you, sir. Commissioner Isnardi?
Yes, and I want to thank Commissioner Pritchett for bringing that up, because my job outside of this one is just as important as this one, at least at this time, related to what is happening. If I had a different job, obviously, that would become secondary, but I'm also serving my community by making sure that I have a healthy community and that I'm seeing the patients that need to be screened and otherwise. So I would just encourage you, and perhaps we need to make a policy change to make sure that we check availability of commissioners, because I know we're all busy, our offices are busy, we're out in the community, we're doing what we can, but because of my profession, I'm able to serve the community in both ways. So neglecting one of those duties, I think would be shameful. So, I mean, I know I'm calling in because that was decided it was the best to keep you guys obviously safe and to keep me from coming in contact with you guys in person. However, asking me to neglect my community that I serve as a healthcare professional at this time probably isn't wise either, whether it be by the phone or having to cancel appointments because I need to sit in a commission meeting for an hour. So if we could just we could even schedule that time outside of those office hours if need be, but to schedule that time on the 1 or 2 days that I'm working in the community as a healthcare professional probably isn't the smartest thing to do with our time.
I appreciate that. No, absolutely. Anything further from anyone on staff or on the commission or over in the clerk's side? You guys staying healthy over there? All right, good. That's what I like to hear. All right, we'll go ahead and adjourn it at 1:23. Thank you, everyone.
The opinions expressed by any member of the public during any period of public comment do not necessarily reflect the views or opinions of the Board of County Commissioners of Brevard County, Florida, Space Coast Government Television, or the program sponsor, and are solely those of the presenter. The Board of County Commissioners of Brevard County, Florida, Space Coast Government Television, and the program sponsor hereby expressly disclaim any and all responsibility or liability for any defamatory or slanderous statements expressed by any member of the public during any such period.